Hey everyone, welcome back. So this week I want to talk about lower back pain. We recently had a patient come to us. He is post-operative. He had a lumbar discectomy and he had his spine stabilized through surgery. So we are working through his rehabilitation. And one of the things we discovered, there's a lot you can do immediately post-op with a lumbar spine patient because he is missing a ton of hip mobility. And so one of the ways that we're getting him significant relief early in his rehabilitation process is recognizing that he has a hypolordotic curve. So his back is actually very, very flattened out. Most of the time we see a lot of hyperlordotic curves, meaning that we have an anterior pelvic tilt. He actually has a posterior pelvic tilt. He's pretty much lost his lumbar curve. Not only that, but his pelvis on both sides, the ilium on both sides, they are kind of in a sense flared out, and his tailbone is really compressed. So if I show you that with a more flexible model, so his pelvis on both sides is flared out. If you can see, what will happen there is if we flare that out, the tailbone is actually going to tilt backwards. That's going to flatten out the lumbar spine. The other thing that happens with this, so this is now locked in place. We have a bunch of tightness across this area. It's very compressed and immobile. And the other thing that happens along with this is you can see when you're in that flared out state, you have external rotation of the ilium on both sides. That reduces your ability to internally rotate the hips. Now your hips can't internally rotate. There's nowhere to go. Not only is he lacking hip internal rotation, but because he's locked in that compressed posture, he is at the end range of his external rotation. So by getting into this position here and staying there, the lower back now has nowhere to go. The hips have nowhere to go. You're going to get a bunch of compression. Eventually those discs are just going to give out, and that's pretty much exactly what happened. So with someone like this, somebody with a hypolordotic curve, compressed across the tailbone, compressed through the ilium on both sides, losing internal rotation simply because of the position of the pelvis, as well as losing external rotation because he's already living in end range external rotation. There's nowhere else to go. One of the first things we have to do is compress him laterally and restore his ability at the ilium, at the pelvis, restore the ilium's ability to internally rotate. We want both of those sides of the pelvis to internally rotate. This will decrease that compression across the lower back, elongate gluteus maximus, which will allow more internal and external rotation. And you can see if we just compress laterally through the pelvis so that we get more internal rotation at the ilium, at the pelvis, that's automatically going to increase the space that he has to go into that internally rotated position at the pelvis. As a result of all of that, his lower back is automatically going to have more space to move into. The demand will be taken out of the lower back, pain will come down, function will be restored. So let's look at two very simple ways, two very easy exercises that are going to allow him to regain that hip internal rotation on both sides and begin unloading that lower back. Okay, so as I mentioned initially, one of the first things we have to do is we have to take you out of this externally rotated position where the tailbone is flexed backward and compressed. There's a lot of compression across here. So the way we begin to do that in a very kind of low threat environment is to place you on your side, get the ground pressing into the pelvis, and begin working on that ability for the pelvis to move side to side just as it normally should. So we're going to get a foam roll, and you're just going to lay down on your side. Laying down on your side, make sure that your spine is in neutral, your head and neck are in neutral, and you can see I've got a foam roll between the knees and between the feet. Now I'm simply going to allow gravity and allow the pressure of the floor to compress the lateral side of my right pelvis, and I'm going to work on breaking my tailbone free and restoring hip internal rotation on the top side. So I'm simply going to pull that foam roll back with my hip and with my knee. I'm going to breathe in as I do so. Long, slow, silent inhale. The more slow your breath in is, the more effective this will be. Long, slow, silent through the nose. Don't overdo it. It's not weight training, it's yoga. The harder you work at this, the less your lower back and hips will be able to let go and find that new space and find that new position. So once again, long, slow, silent, in through the nose, sigh the air out through the mouth. Look for those obliques to squeeze as you sigh that air out. Long, slow, silent inhale. Exhale. You'll want to do this for at least 1 minute on both sides. We'll move on to the second exercise. Okay, so now that we have some motion through the tailbone, now that we have restored some ability to internally rotate through the ilium on both sides, a little bit of internal rotation has very likely been restored as a result of the work that we did in side lying. Now we're going to begin upright. we're going to be working on that internal rotation and that side-to-side motion up against gravity. Now, when you're sitting in a chair for this exercise, don't slouch into it and recompress that tailbone. If you roll onto your tailbone, you're just going to recompress and possibly even flare both sides of the pelvis out again, reinforcing the previous position that we're trying to get out of. So for this exercise, it's really nice if you have a yoga ball. You can also use a small, like if you have maybe an 8 or a 12-inch foam roll, you can put that between the knees as well. Just going to put that between the knees. And so what we're going to do here is we don't want to get the shoulders into this. You want to make sure that you put, if I'm going to work on the left hip, I'm going to take the left hand, put it over the right thigh, and that'll kind of lock the shoulders in place. Now, in this position, I'm simply going to breathe in as I pull my left knee back, maybe an inch, maybe 2 inches, reach the right knee forward at the same time. So I'm going to pull back with the left hip, reach forward with the right knee, breathing in. Exhale and come back to neutral. So you'll want to do this 12 to 15 reps on the left side, 12 to 15 reps on the right side. Cross the right hand over the left thigh. Same thing. Pull back with the right knee. Push forward with the left knee. The longer and slower your breath in is, the more effective this exercise will be. So again, 12 to 15 repetitions on the left, 12 to 15 repetitions on the right. Do that for 2 sets on both sides. That is going to help begin breaking things free, restoring more normal motion to the lumbar spine, as well as helping to loosen up the tailbone and restoring internal and external rotation to both hips. Hope that was helpful. Please reach out if you have any questions about this, and we will see you here again soon.